In this video, we are going to look at a drug called Mdma, aka Molly. We are going to know how specifically drug works in our brain, how chemically Mdma is made up, and of course, how Mdma was discovered in the first place. In 1912-80, German chemists were developing medicine for stopping bleeding. In this process, they discovered unique psychoactive chemical substance which was Mdma. Later on, Mdma was used by psychiatrists as a psychotherapeutic tool. They thought it made their patient more willing to communicate and participate in psychotherapy process. But by 1980s, Mdma was widely known as a party drug. Initially, it was popular in the nightclub dance parties, but the drug now affects a broader range of people who commonly call the drug Molly. Usually, Mdma comes in the form of tablets, pills, and capsule, and the popular term Molly, which is slang word for molecular, refers to pure crystalline form of Mdma, which is totally wrong and it's probably marketing gimmick. In fact, researchers and law enforcement have found that much of Molly sold today contains other harmful and possibly deadly drugs mixed in it. Now let's talk about how Molly affects our brain. Assuming Mdma is taken orally, its content ends up in stomach and small intestine proves to be an ideal site for Mdma to be absorbed. Also, for a drug to be psychoactive, it must be hydrophobic because the drug will be easily broken down in stomach before it can be absorbed in bloodstream if it is not hydrophobic. When Mdma enters the body, it causes influx in secretion of certain neurotransmitters. The human brain contains an estimated 86 billion neurons. Those billions of brain cells communicate by passing chemical messages at synapse, which is small gap between cells, in a process called neurotransmission, and those chemical messages are neurotransmitters. One of the interesting things about this neurotransmitter is that they affect psychological functions such as fear, mood, pleasure, joy, and many other aspects. There are many neurotransmitters in our brain, but Mdma affects brain by secreting mainly three of them. Dopamine, which acts as reward system and increase energy and activity of body. Norepinephrine, which increase heart rate and blood pressure. And most importantly, serotonin, which plays important role in regulating mood, sleep, pain, appetite, trust, and also triggers sexual arousal. So if anyone takes Mdma, then the effects will start within 30 minutes and it may last up to 3 to 6 hours. He or she will feel sense of euphoria, emotional warmth and empathy, sense of closeness and intimacy, and it also reduces normal sexual inhibition. Also, some users experience negative effects such as being anxious and agitated, becoming sweaty, having chills, or feeling faint or dizzy. Even those who don't feel negative effects during use, they can experience bad after effects. Even weeks later, people can experience confusion, depression, sleep problem, drug craving, and anxiety, because the source of serotonin caused by Mdma reduces the brain's supply of this important chemical. In fact, research in rodents and primates has shown that a moderate to high dose of Mdma given twice a day damages nerve cells that contain serotonin.